Good afternoon, everyone, and welcome to today's webinar, Uncharted Waters, Caring for Hospice Patients and Families in the Face of COVID-19. This complimentary webinar is brought to you today in collaboration with Alzheimer's Orange County and O'Connor Mortuary. My name is Melissa Klabe, and I'm going to be your host today. I'm the Director of Education here at Alzheimer's Orange County. Dr. William G. Bill Hoy is Clinical Professor of Medical Humanities at Baylor University. He's widely regarded as an authority on the role of social support in death, dying, and grief, and his experience includes more than 20 years leading bereavement and pastoral care programs in hospice care. Though primarily a bedside clinician, Dr. Hoy has authored more than 125 articles and book chapters, as well as 6 books. His books in print include The Road to Emmaus, Pastoral Care with the Dying and Bereaved, Do Funerals Matter? The Purposes and Practices of Death Rituals in Global Perspective, and of Bereavement Groups and the Role of Social Support, Integrating Theory, Research, and Practice. In addition to his role with students at Baylor, he's a frequent presenter among groups of professional colleagues in healthcare across the US and Canada. Dr. Hoy is active in the Association for Death Education and Counseling, on whose board he served from 2012 to 2020, including 6 years as an officer. He also holds advisory board positions with Our House Grief Support Center in Los Angeles, Pathways Volunteer Hospice in Long Beach, California, and the Tragedy Assistance Program for Survivors in Washington, D.C. Bill and Debbie Hoy make their home in rural central Texas, about 25 miles from the Baylor campus, and are excited every semester to welcome dozens of medical humanities students into their ranch home for dinner and fellowship. They're parents to 2 adult children, a super son-in-law, and a delightful granddaughter. And again, it's my pleasure to now turn it over to Dr. Hoy.
Well, thank you, and I'm delighted and honored to get to spend the next 55 minutes or so with all of you who I realize are my colleagues, most of you probably taking care of hospice patients. Many of you, I realize, wishing you were taking care of hospice patients, but for one reason or another have been locked out of the settings where you can do that. So I am delighted to get to spend some time with you this afternoon. Clearly, we are living in a world of uncharted waters right now. This is a time that none of us anticipated, none of us are particularly prepared for. I was reflecting with one of my colleagues, Dr. Lou Gamino, who is a clinical psychologist about 30 miles south of me at the Baylor Scott and White Temple Medical Center location. We were talking just this morning, and I joked with him that I must have been absent the day in my graduate training when we covered this, because I don't recall anything about how to deal with pandemics when they come home to us. And certainly you don't need me to show you slides to demonstrate the depth of what we are walking through right now, but to say that it is uncharted territory would be to put it mildly, at least. The Manchester, Connecticut Journal Inquirer just a few days ago in an editorial wrote these words: "We're in uncharted waters." My question is, okay, so then what do we do? And what I would like to do in the next few minutes with you are offer what I believe are 5 P's, 5 principles, 5 strategies, if you will, for how we go about taking care of patients. And that would certainly extend to taking care of parishioners, taking care of clients. If you are a psychotherapist now faced with trying to provide some kind of support online or by phone, it would certainly be true for folks in Alzheimer's Association who are trying to maintain some kind of support system, again, telephonically or via Zoom calls or some kind of other web-based system. So what do we do? Well, I'd like to offer these 5 strategies. The first one, and they'll all start with a P. The first one is to practice good self-care. Now that might sound like I don't need to say that, but the truth is I probably don't need to remind us as professionals today that we cannot give that which we do not have. And so staying healthy and staying both physically, mentally, emotionally, and spiritually healthy is absolutely essential. And it's a challenging time to do that. We cannot afford to get sick, but to be honest, we have to also be careful not to become exposed to something that would sideline us for 2 weeks while we are quarantined or something like that. So I remind us of the importance of the same things you've been hearing from the CDC, the WHO, and most every other 3-letter abbreviated government agency in the world. That hand washing for 20 seconds, which I hope all of us in healthcare have been doing all along, but nonetheless is essential. Several of my colleagues and I have started using the term physical distancing rather than social distancing. We are delighted that the World Health Organization has joined our party on that now, and they in their missives have begun referring to physical distancing. The Centers for Disease Control and National Institutes of Health have still not joined my party on that. But I encourage you to, because one of the things we're seeing, and I'll talk more about this in a few minutes, but one of the things we're seeing, of course, is the incredible level of social isolation, and unfortunately, using words like social distancing tend to imply isolation. And so we're trying to say what it is, and that is we're after physical distancing. We're not at all interested in social distancing. Nutrition, rest, exercise, more important than ever. Watching carefully what you eat, making sure that you're sleeping adequately. One of the things that I do pretty religiously anyway, but I've really gotten I've gotten just I don't know rabid about this in the last few weeks, is to not watch any news, not to look at anything on the internet, not to do anything on screen the last hour before I plan to retire at night. We've known for years that the blue light emitted from screens, whether it's your smartphone or your computer, does disrupt the melatonin system. It disrupts your ability to fall asleep. But that is more important than ever because of the emotional taxation that goes along with watching news or catching up on whatever Fox, CNN, NBC, BBC, or whoever your favorite news outlet might be. So, and then, of course, exercise. Making sure that we're getting out. We don't have to be with other people to exercise. If you're physically able, get out and walk. Just make sure you don't get up close to people, but walk. If parks are open in your community, some of ours are, some of them aren't, but if parks are open, that's a great place to go. Again, walking around the neighborhood, you can speak to people who are sitting on their porch. I guarantee you that you're not close enough when you're standing on the sidewalk and they're on the front porch to share any kind of viral germs. So go ahead and speak. Give a smile, those kind of things. Making sure that we're doing things that are relaxing, other than reading Facebook or other social media. I am finding that that's not a terribly relaxing thing for me to do. And I'm not on social media anyway, but I'm trying to stay away from those kinds of things as much as possible. The misinformation that is being shared on Facebook, as a case in point, is so out of hand that it's just honestly not worth my time. My daughter texts us pictures several times a day of our granddaughter, and then I don't have to go look at my wife's Facebook account to see them. So Debbie and I started back around Christmas time because we had some extra time on our hands, working jigsaw puzzles, and that's been a huge thing for us, and it's very relaxing. It takes us away from all of the normal caregiving kinds of things. So find some things that you can do with the people who you share a home with, or that sort of thing, if need be. Spiritual well-being. I guess most everybody that is attending worship now is having to do so via the internet, and I know it is a very, very, very poor second place. I enjoy listening to well, in my case, it's contemporary Christian worship music, but that may or may not be your thing. But some kind of music that builds your spiritual fitness. Listening to the scripture being read as it is on many internet channels, Gateway, let's see, BibleGateway.com is one of those, and might be really helpful for you, even if you're tired and don't want to read it yourself. So spiritual well-being, and then mindfulness, and making sure that we're taking time to stop and to think about who we are, to maybe do some visualization, seeing relaxing pictures. I have some landscape photos on my computer that I scroll through that sort of help me to think about art and beauty and those kinds of things. Can be very, very helpful. So practicing good self-care is really, really fine. I came across this just this morning. It's called Self-Care Bingo. And you'll notice the website from which I got it. I'm not a great big fan of naturopathic medicine, but I happened to come across this from the Association of Accredited Naturopathic Medical Colleges, or AANMC.org. And it's right up on, actually, I think it's up on their web page, on their homepage. It's called Self-Care Bingo, and you could probably just Google AANMC Self-Care Bingo, and this will come right up. But it's just kind of a fun, whimsical kind of thing to maybe play bingo, not only with people in your family, but you can do this, set up a Zoom call with your friends and play bingo together or something like that, talk about what you're doing. And if you want to really be creative, shuffle these around and then share the bingo cards with your colleagues, and get on the phone or get on a Zoom call every evening at 7 o'clock and play bingo together, and see what you come up with. Okay. So anyway, self-care. The second P, not quite so lengthy probably as that first one, is to put data in context. Everybody knows the photos of these two physicians. Their names have become household words. Whatever you think about government administration, and those kinds of things, let me just say a word about these two physicians. Tony Fauci, I first came into awareness, I suppose, of Dr. Fauci back when I was taking care of AIDS patients in Long Beach, California in the mid-1980s, or actually early to mid-1980s, when we knew AIDS was universally fatal, and we did not know that how exactly AIDS was transmitted. And Tony was the one voice of sanity for those of us doing healthcare back then. You may not have known his name, but you certainly knew his work, and he has been at the helm of the NIH's section, the center at National Institutes of Health that manage infectious diseases ever since. And he has become really one of the sane voices. And of course, Dr. Birx, Deb Birx, has also become that. And through thick and thin, through presidential campaigns and White Houses to the left and White Houses to the right, and White Houses in the middle, they have both been physicians that have really guided, I think, our public health efforts in extraordinary ways. And the reason I put their pictures there is because it reminds me that I'm trying to listen to people who are in the know about data, and I'm not trying to get my data from the Los Angeles Times, the Orange County Register, or in my case, the Waco Tribune Herald. I think it is important for me that I go to the source. Now, I'm a scientist, so you probably expect that. And when I say the source, I mean going to the authoritative people who are paying attention to public health numbers. And the CDC and the NIH are doing a very, very fine job. I've relied on their mortality data all of my career, and I don't plan to stop now. But when I say put data in context, I think what happens, and I'm not trying to throw the news media under the bus particularly here, but one of the things I realize is that the news media is not in the business of providing data in context. The news media is in the business of drawing us into a story, and that is usually done through anecdote. And good storytelling is actually what sets a good news story apart from a bad story. We don't want just facts and figures, we want the human interest dimension. But for those of us who are working in healthcare in this context, I think it is extraordinarily important that we return to the source. And let me explain what I mean by putting data in context. So this chart right that you can see on your screen actually shows the 2017 and the 2018 number and then death rate. That doesn't mean a lot to you, I'm sure, and there's no need for me to get into all of those numbers particularly, but I show them there because I want you to see kind of what we're really talking about. Now, I am not for one moment depreciating the power of this particular virus and COVID-19, that is the illness that grows out of coronavirus. I'm not for one moment suggesting that it is a farce or that it is not accurate or that it is not true. Not for one moment. It is a horrible, horrible disease process. We are, in my judgment, we are doing many of the right things to lessen community spread. At the same time, it is extraordinarily important that we who work in healthcare, as we support our family and friends, that we help them put data in context. The current expectation, worst case scenario, assuming we stay on the tack we are currently on with physical distancing and keeping restaurants and bars closed and limiting the amount of social interaction that people have, the tack we are on is that we are talking about in the United States a number of deaths between 100,000 and 240,000 at this point. Now, it may not go to 240,000, but if it does, and that's the current worst case scenario estimate that our best public health estimates give. Now, that's not the doomsday kinds of estimates that you've seen coming out of the UK and some of those which are based on entirely different models than the ones we are operating on and the ones that seem to be accurate based on what has happened in Italy. And Italy is our best test case at this point. It's not China because we're not sure of data there, but we are pretty sure the data coming out of Italy is accurate. The models that we are using now are based on our best guesses based on all of that information. If we have 240,000 deaths in the United States, and if none of those 240,000 people who die from COVID-19 would have died this year, what we can expect is that our average annual 2.8 million deaths will become around 3 million deaths, or in other words, a growth rate of approximately 8%. 8% sounds a whole lot less than 240,000, and it's because it is. That's not to say that this is easy for the 240,000. It is to say that if you look at the data, what you see is that if coronavirus in its worst case scenario were to kill 240,000 people in the US this year, it would still not get even close to the number 1 or number 2 causes of death in the United States. It would be a distant number 3. If the number of deaths actually tends to fall somewhere in the 100 to 150,000 number or even lower, which is what many of my public health colleagues are thinking is a reasonable estimate, then it may show up being the number 4, 5, 6, 7, and perhaps even number 8 cause of death this year. That is not to put it down. That is not to say that it is not a bad thing. It is to remind us that last year across the world, 1 million people died of malaria and 1.3 million died of tuberculosis. And that happens every year around the world. And we must put this data in context. We must do that for ourselves. It's good self-care, but it is also good for those around us who may not be on the inside of healthcare and may not understand that the levels of fear and anxiety and hysteria that is going on in the grocery store aisle is not by and large what I'm finding from my colleagues who are on the inside of hospitals. I talked with a physician in New York yesterday who is at NYU, and she said things are very calm, and she is not particularly frightened. They are taking precautions, but it's a very different story than when you get the anecdotal picture here and there that we sometimes depend on. And so my reminder to us is to take a breath as well, even as we're providing support to others to encourage them to take a breath. Our anxiety becomes a communicable disease in itself to the people around us. And as soon as my slide advances, which for some reason it isn't doing, there it goes. Here's the fourth one, the third one, I'm sorry. The third P is to promote planning and control where possible. So we tend to emphasize in this era what it is we cannot do. We cannot go out, we cannot go to the movie, we cannot have dinner out with friends, we cannot go to the bar, we cannot go to church, we cannot have funerals, we cannot do all of those things. One of the things that seems to be very helpful in these kinds of experiences, even though this one we've never been here before, we have had bad things happen. And one of the things we can do is to think about what are the possibilities we have. So it is true that I am now needing to stay at home. One of the advantages to that is that I have a cleaner desk than I have had in several months because I've had some time to work on that and to put things in their place and to catch up on filing. I realize one of the things that I have done is I've spent more time just talking to friends instead of depending on texts and emails. And I'm going to talk about that strategy in just a few minutes. But what I'm suggesting is just yesterday I had conversations, real honest to goodness, voice-to-voice conversations with a dozen different people. Some of them lasted 10 minutes, some of them for close to 30. But what I'm suggesting is there are lots of things we can do, that we can exercise control, that we can plan for. One of the possibilities, of course, is to set specific dates for future events. Instead of saying we can't have a memorial service or we don't know when we'll be able to have a memorial service, let's go ahead and put a date on the calendar. If we need to change it, we'll change it. I learned this principle from a student of mine, well, now former student of mine, just a couple of days ago. Emily and I were talking. Debbie and I we've canceled them now, but we had airline reservations and hotel reservations to go to Minneapolis for Emily and Josh's wedding on the 2nd and 3rd of May. And so we were preparing to do that, getting ready to go. They, a month out, realized, okay, there's no way we're going to be having a wedding for all of these people. Our church won't do it. The governor has said we can't have gatherings that big. And so they've gone ahead and just pushed their wedding forward and rescheduled it and lined up the caterer and all of those kinds of things for July the 19th. When I talked to Emily a couple of days ago, she said, you know, I'm disappointed, but we talked about it, and what we decided was we think we would regret it more if we didn't go ahead and have the wedding we were planning and just got married by the minister in mom and dad's living room, which we could do, and that would keep it under 10. We decided we'd rather wait for an extra 8 weeks or so, 10 weeks, I guess. We decided we'd just rather wait a little bit. And I think that's an amazingly mature kind of perspective. Another of my students, a current student, he and his fiance are getting married. Their wedding was scheduled for May the 30th. Another one that has to be canceled because of social distancing and no gatherings and all those kinds of things. And I was talking to him yesterday, and he said, you know, what we have decided to do is we are going to get married with just mom and dad, grandparents, and a sibling on each side, and the minister. That keeps us under 10. We're going to do it in our backyard so everybody can stay 6 feet apart from each other. And then we are going to plan a reception in the late summer or early fall. We don't have the date set, but it'll probably be around August the 15th or so, right before I start med school. And we want to go ahead and start our life together. And so that's what we're going to do. In both of those couples' cases, one of the things I find striking is that they are both choosing to take charge and to talk about it and to do that which meets their needs, and to take into consideration the people around them as well, and to say, you know, do you think this is a good idea? What do you think about this? So what I'm suggesting is those are things we can take charge of, and we can help our patients and our clients. Okay, if you can't do this, what can you do? And then I'm encouraging the folks that I talk to write about these experiences, to keep a blank book handy. I love Moleskine, which you can buy on Amazon for about $18, I think. It's my favorite because I like the way the paper writes. But whatever kind of blank book you use, write down some of what's going on. Write what you're thinking, write the experiences, write how this is impacting you, write about the losses that you're encountering, and to make sure you encourage your clients and patients to do the same thing. This will be a treasure for our grandchildren or great-grandchildren who will not remember this event, who will not have experienced it. In the same ways that we would give anything to have those kinds of recollections written down from our grandparents, or in some of our cases, our great-grandparents who lived through the Great Depression or who lived through World War II. We'd give anything to have those kinds of experiences written down. After my wife's dad died 4 years ago, or almost 4 years ago, we found a book that he had started several years before his death, and he told some of those stories, and it is a family heirloom. It's a treasure. We didn't even know he had been writing in this thing, and they were just recollections and things he remembered from boyhood that told stories that none of the 4 kids had ever remembered hearing. And so I think if we will write these experiences down and what we're doing about them, it will actually reduce our own anxiety, because there is something about the power of expiating this onto the page that helps take some of the power out of this. And then another thing we can do is, when given lemons, make lemonade. So this photograph was sent to me a couple of days ago by my friend Tommy McAfee. Tommy and his brother are the owners of Thomas McAfee Funeral Home in Greenville, South Carolina. And the McAfees joined in with funeral homes all over the United States in what they call a Hugs from Home program. Their chapel, as you can see in this photograph, is filled not with people for this person's funeral, but instead are filled with white balloons, helium-filled balloons, each one of them tied to a ribbon with a note attached to it that a friend of the deceased sent to the funeral home, and asked that note be printed and tied to a balloon. And so when the family joins together for the funeral, it is true the chapel is not filled with their friends, and this is a poor second for that, but it is sure better than an empty chapel. And to look back, and Tommy said, and to see all of those balloons, each with a note that this family can enjoy reading and remember the life of their loved one later, will be an incredible gift to them that they will treasure. And what I know from deaths in my own family is we forget the things people say to us anyway. And in many ways, having them written will be an important treasure for this family in the months and years ahead. I appreciate my friends who are, of course, the co-sponsors of this workshop, the O'Connors, who are reminding their community the same way to look out for our healthcare professionals, and to make sure that we're following the kinds of things that will make his life as meaningful and as helpful for all of you as we can. Here's I believe this is my fourth P, my fourth principle, and that's to permit frustration, sadness, and loss. We must honor the loss of this moment. There is no question, not only are we experiencing the deaths of people that we love and we care about, and in some cases we are seeing 2 and 3 deaths and 4 deaths in a single extended family or friendship circle. We must honor that loss. We must honor it and say it is all of the horror that it is. We must honor it. We must say that it is difficult. At the same time, in honoring the loss of this moment, it is important that we realize that the losses that we experience are not just losses of loved ones by death. We are losing graduations from high school and college. And I don't know about other institutions, but at Baylor, we've moved our spring commencement to the same day as our August commencement, and we'll do them all together. But what I know for without any question, talking to some of my seniors, that they are experiencing the loss of what they had hoped would be these last few weeks together with friends that they've lived with and spent time together with for the last 4 years. And even for many of them, the option will not be to come back for graduation, because I work primarily with pre-medical students. Many of my students will already have begun classes in medical school by the time we have commencement in August, and the nature of their schedule in the early weeks will make it impossible for them to return to Waco for that event. And so it's an event that just won't be for them. And I think we have to honor we have to honor the loss of that. We have to honor the loss of the woman who is one of and this story is multiplied hundreds of times, that I heard of just in the last couple of days from a funeral director who was telling me about a woman whose husband died just over the weekend, not even from COVID-19, but died in a nursing home. And when she said goodnight to him 2.5 weeks ago, she fully intended to return the next day like she did every afternoon, to spend the afternoon with him. And she kissed him goodnight and she said, "Honey, I'll see you tomorrow." And then in the intervening hours, that nursing home made the administrative decision, as did many, to no longer permit family to come into the nursing home. And so what she has in her mind now is the sense of loss and regret and guilt that she told him she would see him again, and he died before she got there to do so. And that is a loss that we will be, I predict, sweeping up the pieces from, not for weeks or months, but for years. That is not going to be an easy task. We have no idea where this will go, but to pretend that this grief that comes about not just from people who've died by COVID-19, but all of the other deaths and losses that we are experiencing through this era, there is absolutely no question that we have never seen the level of complicated grief that we will most likely see in the remaining years of our career. And many of us will be at and past retirement age before we will have finished, I would predict, sweeping up the pieces from this event or this series of events. We must honor the loss of this moment. But we must also be careful to honor the disenfranchised loss that is part of this moment. I have already heard it said, because one of my students told me, how can you possibly feel sad about having to move your wedding when all these people are dying around the world? And one of the things that I learned a long time ago is that the loss that I'm walking through today is probably the biggest loss on my plate right now. And for us to put down other people's grief because it doesn't measure up to our artificial terminology about what on our own private grief pecking order something ought to be is absolutely criminal, and it is cruel. And so I think we must be people who, when we hear those kinds of nonsensical things said by our family and friends, as they put down the losses that people around them are experiencing, is for us as professionals to step into that and say, stop it. That is inappropriate. And here's why that may be a loss that is worth grieving. But we also have to be careful because of the tendency we sometimes have to put down our own losses and to say, how dare I feel sad about this loss that I'm experiencing when so many people are dying and losing their loved ones without being able to say goodbye, or those kinds of things. And I think it's always a delicate balance for us. But one of the things we can do is to become extraordinarily mindful of our own losses. What are the things I'm losing? What are the things I'm not getting to do or to say goodbye to? And those are valid. And resist the urge to put those on a pecking order and to say, well, at least I'm not as bad off as that person, or at least I'm not having this happen, or and so I ought not feel bad for it. I think instead what we can say is, I'm grateful that right now I'm living in a good place, and I'm living with people who love me and who care for me, and I'm delighted that I'm getting to help folks and to be of some benefit, and I'm delighted that I get to use my, what in the university setting we call our public intellectual selves, where we spend so much time when you are a specialist in a particular arena, as I'm doing right now. I mean, nobody's ever interested in funerals, but all of a sudden in the last 2 weeks, I've granted news media interview after interview after interview, from Rome to New York to Los Angeles to Waco to Dallas to Houston to Miami, from reporters that are wanting insight about what we're dealing with. And I think what we have to do is we have to honor our collective experience with loss by in part saying the loss is great and the hope is also great. And then I think it is important that we honor our collective need for patience and for grace, to work extra hard to be patient with the cashier at the supermarket, who is probably very anxious right now, or maybe doesn't even want to hand our cash back to us, but wants to just drop it in the bag or something like that. And instead of saying, oh, that's dumb, or I don't know why she's acting that way, or, why is this person annoyed with me for getting too close, or whatever the case may be, is to try to tell myself all of us need an extra measure of patience and grace right now. And then my final strategy, my fifth P, is to plug into others. I'm trying desperately to phone at least 3 friends every day, and that means for me not text. That's the easy thing, is to shoot a text or an email, but I'm trying to pick up the phone and call. I know I won't always reach people at a good time, but you know what? We all have voicemail, and I have discovered that if I can't take a call, it goes to voicemail, and it will be just fine for me to call back later. I'm not worried about interrupting. I'm not worried about that right now. I instead want people to hear my voice, even if it's a voice on the voicemail later, that they hear a message that says simply, hey, Phyllis, I was just calling to check on you. I just wanted you to know that I'm thinking about you. I'm thinking about Lily. I'm thinking about what you guys are dealing with right now. I'm thinking about what's happening, and I just wanted you to know you're in my thoughts. I've been astounded at how many of those messages I've left have been responded to within the hour. Sometimes I leave messages that are ignored for days on end, and nobody seems to be ignoring my calls now. So I think part of that is we long to hear the voices of others and not be dependent just on email. I think it's important that you and I say thank you with eye contact. If you go to a restaurant and you pick up your food, I would recommend that you look directly from 6 feet away, directly into the face of that waiter or waitress that brings the food to your car and say, thank you for being here. And that leads me to the third one, and that's to tip big. I don't know what possessed me to do it, but yesterday I went and picked up a couple of Subway sandwiches and handed the guy that brought them out to me a $20 bill. And I don't know why I did that. I'm certainly not bragging about it, but I think there is something about us acting with gratitude and generosity to the people around us that also has a rebound impact on how we feel and the kind of care we give. And so I'd encourage you to say thank you with eye contact and to tip big. And then maybe the last thing is to express positivity in conversations. I'm trying to see what is good. I'm trying to see what is profitable. I was telling Dr. Gamino, my friend, just this morning, that one of the things I predict is that we will realize through this experience that very little of what we have always thought that connecting on the internet, Facebook, or even by phone was as good as being present in the room. And I think we are learning very clearly that it is not the same. A funeral director who may even be listening in today from Indianapolis was just telling a group of my students yesterday about what she is hearing from family members about their missing physical touch, and that they so desperately wish to have a hug from somebody in the horrors of walking through the death of a loved one, and I cannot be touched. And I think that that is not good for the culture writ large. And so in the absence of physical touch, I think we have to be positive. We have to speak with positivity. We have to talk about that things are going to be better, that things are going to be better. And every data point points to that direction, and every bit of experience points in that direction. This is not the apocalypse. This is not the end of the world. We will get through this, and to speak with positivity about the things I'm learning and what I'm growing. I've already discovered new ways to use Zoom that 3 weeks ago I didn't know how to do, and I've already learned how to do other kind of technological things because Baylor moved all of our classes to online. And you know what? I hate it, and I go to online education kicking and screaming. But the truth is, I've learned some new skills, and I've learned to do some things. And I've had some meaningful conversations with my wife's mother, who we brought to stay in our home 3 weeks ago, and will be here for I don't know how long. And I'm learning things about my wife's family's background that neither she nor I had ever heard, and that's a positive thing. So to express positivity in the conversations that we have, to say regularly, I'm grateful to you, I thank you for what you're doing. And I believe what we will find is that in the end, we have a choice in front of us. We can pretend that we are going to be ruled by the sharp curve that is ahead, and we don't even know how sharp that curve is yet. Or we can be ruled by the anchors in our lives. And the anchors remind us that we are fundamentally people of character, not measured by what we do, but rather measured by who we are, that has an outgrowth in what we do. And I don't care if I am remembered for knowing a lot about bereavement or funerals or taking care of the dying. I don't expect that that will be something that anyone will feel compelled to write on my tombstone. But what I do hope people remember is that they are able to say with all honesty, he was a person who loved me. He was a person who loved me through the thick and the thin of it. He was a person of kindness who smiled and who expressed gratitude and generosity through his life. I believe, and I say this, those of you that have heard me talk about the grief process anchored by what I call remembering, and that remembering is the storytelling part of grief, but it is more than storytelling. it is also about finding the character qualities that anchor us in the midst of this loss. And that what we do not long remember are the echoes of the details of the story, but we never forget who people are. So as you take care of the dying and the bereaved, and maybe most importantly of all, yourself, I encourage you to remember that what we have to give fundamentally is not our activity, not our strategies, not our techniques, not our interventions. What we have to give fundamentally is who we are.
Thank you so much, Dr. Hoy. That was really incredible. I particularly loved the last slide, plugging into others and phoning at least 3 friends every day and finding myself connecting with long lost friends. It's a good excuse to kind of call up, everyone that I have lost touch with and make sure that they're doing okay. I want to remind everyone that now please type in questions if you have them. We've got about 10 minutes for questions. So please do share those. I want to thank O'Connor Mortuary again for partnering with us on this webinar. And a reminder, if you are seeking CE credit, to please stay online for 60 minutes and complete the evaluation that will be emailed to you at the conclusion of the webinar. I don't see any questions yet, but I have a question, Dr. Hoy.
Sure.
For those of us kind of sheltering in place and staying home, do you have any suggestions for ways that we can support those frontline or healthcare workers and what they're going through right now?
Well, I do have some. So one of the things that my students are doing is they are writing notes, just personal handwritten notes to frontline caregivers, and giving them to a hospice to distribute to nurses and folks like that. Now, certainly don't do that if there is anyone in your home who is contaminated. Make sure that you've not been within in any place where you could have contracted the virus in the last couple of weeks. If you do that, make sure maybe that I'm not sure if this even works, but I would probably then put those notes in a Ziploc bag and spray some Lysol spray and then seal it up and then deliver that to a hospice organization or to that would be one way. Certainly, and I will tell you that the National Institutes of Health is looking seriously at some emerging research about the use of masks, and I've not seen if there has been any new guidance provided today, but as of yesterday, the guidance still remains the same, and that is to not use any PPE. And the reason is not because you don't need it, it is because it is not an unlimited supply, and we need to be careful that the folks who are going to need that most do have it accessible to them. I would imagine that we are going to, in the next few days to weeks, catch up with our production of personal protective equipment. But in this interim time, it would really be better not to use things that you don't need. The CDC's guidance is very clear about that. I think if you want to buy some gift cards and give them to colleagues to use when restaurants open again, or of course, many of the takeout places are even open now, and I think that would be a very generous and kind thing to do. So there's some practical things. I think just saying thank you. I did, by the way, have a physician in New York. Actually, she did not tell me this. Her mom told me this, but she directly quoted her daughter just yesterday, who said, please quit calling us heroes. We are doing what we were trained to do. She said, we are not heroes. Please quit using that terminology. We are simply doing that which we are called to do. And I think I want to be mindful of that. That may not be a moniker that a healthcare professional wants to hear. And so be careful of that. Be a little more specific. If you're not a healthcare provider and you want to say thank you, just say, I know you're working extra hard. I know this must be exhausting, and I really am very grateful that you are willing to stay out there on the front lines for the rest of us. And honestly, I don't know that that's a lot different than many of us do when we see a person in uniform, whether it's a police officer or firefighter, a member of the military personnel or whatever, to say thank you for your service or something like that. And I think what we're doing is we're just extending that to another group of frontline caregivers. And maybe put a note and a treat of some sort taped to the top of your trash can that you put out for the person who picks up your who collects the trash in front of your home, or leave something out for the UPS person or the Amazon delivery guy. I think those little acts of kindness not only express gratitude to the people on the front lines, which are not just healthcare providers. In fact, we're already wrestling at a public health level for how this may impact people who are collecting the trash. And what does that mean as more and more people put contaminated Kleenexes and things like that into the trash container, and then that's getting picked up, and if it's not in a sealed bag, it's getting dumped into the refuse stream, and all of those kinds of waste stream. And so I think just being mindful of those things can be very powerful.
Thank you so much. Absolutely. Okay, so we've got some good questions coming in. We've got about 5 questions, and I think we should be able to get to all of them. But I want to remind everyone that if we don't get to your question, I apologize, but you are welcome to email Dr. Hoy. He's made his contact information available on this slide. So thanks for all the questions. The first one is, we missed, excuse me, we missed all of the 5 Ps. Would you quickly restate these? And just before you do that, I want to let people know we unfortunately can't share the slides for this presentation, but there will be a recording available, and we'll let you know how to view that.
And what I will do, I just you guys know we put this together very, very quickly, so we're sort of playing catch up. And I did 3 news interviews this morning, so honestly, I feel a little bit like I'm about to meet myself coming back, as my mother used to always say. I will get a Word document to you to post later today that sort of outlines some of these ideas so that folks don't have to wait. I just have not gotten it done, but I will get it done before the end of the day. But the 5 Ps are, the first one is to practice good self-care. The second one is to put data in context. The third one is to promote planning and control where possible. The fourth one is to permit frustration, sadness, and loss. And then the last one is to plug into others. So I will put those up in a Word document, and I'll send that to the folks at Alzheimer's. And I don't know how you'll distribute that, but however you'll put it up on your website or whatever,
Absolutely.
I'll be glad to offer that to you this afternoon.
Great, thank you so much.
And I might also add, my email address is at the bottom, and I am honored and delighted to respond to emails. It might be a day or so before I do, and if it's not something of great urgency, I would appreciate your patience in that. If it is of great urgency, just please write in the subject line, "This is urgent," and then I'll move it to the top of the stack, and I'll try to get to it right away.
Awesome, thank you so much. Next question, how would you counsel someone who is burdened by the inability to visit a loved one right now in memory care or long-term care?
Yeah, so I'm going to really concentrate on this notion of focusing on what we can do. So what you can do, assuming that both parties are both visually and hearing abled, so there is not any hearing or visual impairment on either side. One of the things we're doing in our hospices here is that we have provided some tablets to nursing staff, which of course are the only staff who are visiting patients who are in facilities now. Nursing staff are taking those in and letting them have a conversation by at least FaceTime or something kind of like that with their loved ones at home. So certainly if you can do some things like that, that's very helpful. My friend Louis Gamino was telling me this morning about someone that The guy was an electrical contractor, so he took his boom truck, that has the little cherry picker thing. His mom lives on the third floor of an assisted living, and he raised his boom up so he could actually speak to her through her window. And now, unless you happen to have a boom truck in your backyard, I suppose that's not something you can do. But what I appreciate is the creativity that people are exercising in finding ways, standing outside the assisted living or the window for your loved one with a sign or something like that can be very powerful. So doing something if I can't do everything. Talking by phone, talking by FaceTime, writing notes. Again, we don't think that this virus is particularly transmissible by paper and things like that. But I certainly am going to exercise caution. But to send notes and some of those kinds of things can be very useful.
Great, thank you so much. Another question is kind of two people asked very similar questions. So how do we handle other friends or medical friends who are not keen on social distancing or not practicing safe activities? How can we maybe kindly ask them to be more respectful, careful?
Yeah, so I like to ask questions. I see you're getting really close here. Are you not particularly bothered by risks? I sometimes will. I have used sarcasm a couple of times. I went in the grocery store the other day, and there were about 8 people gathered at the meat counter. And there wasn't any shortage. I'm not sure why but they were all, sort of crowded together. And as I pushed my cart by, I said, watch your physical distance there or something like, and they all kind of laughed, but they spread out. So sometimes I think we just have to be reminded, we're just not used to this. So again, I would express grace and kindness and reminders. If it is somebody that is, a friend or something, obviously I can choose not to be around them right now. If that's important to me and it's not important to them, I can make a choice too. I'm empowered to do that and to step away, or when somebody moves close, take 3 steps back. And people will get the clue pretty fast. If I step back when you step toward me, in the olden days we thought it's because I stink, but now we realize, maybe that's important. And I think only a buffoon would then just crowd in again. And so then I may just have to say, I'm really trying to follow the guidance about physical distance. So I appreciate you doing that. And in the same way that they need to respect other boundaries, they need to respect that one as well. I skipped over one item I was going to say a minute ago about the other question on the how do we help people. What we're really doing reality testing, that's the psychological strategy. What I'm doing is, and I can do this with any kind of guilt or regrets. I've done it in bereavement counseling thousands of times, probably with patients when they say, I'm so guilty I wasn't with him when he died, or I missed these signs and he died by suicide and I should have known better, or should have been watching, or should have called the paramedics earlier, or could have, had a oughta. And what I try to do in that context, Bill Worden talks about reality testing, that what we do is we say, I give you that you can't do this. Let's talk about what you are doing. Let's talk about what you can do. What stories would you tell him if you were there? What would you say if you were able to say it? And what we're doing then is we're becoming a surrogate. Okay, go on to the next question. Sorry about that, Michelle.
No, that's fine. I think we have time for one more. We do have a few in the queue, but I'm going to reach out to those individuals and make sure they reach out to you. I think this one's kind of important and probably something we're all feeling. This person said, I keep hearing we will get through this. Of course, the world will get through this, but not all the individuals. And this is where our stress comes from. And maybe you can just speak to kind of the feelings behind that statement.
Well, and isn't that always true? I mean, 2.8 million people die in the United States every year. And I am here to tell you that both statistically and clinically, What I can say, having taken care of somewhere, as best I can tell, 51, 5,200 dying patients and bereaved people in my career, is that almost none of them don't get through it. They do. We do. COVID-19 is not the first thing from which people are dying in the world, or even in the United States, and it is no we collectively will get through this, and families whose loved ones die will also get through this. They will get through the grief. It will be very, very hard, but the vast majority of them, we know, are going to do fine with the support of their community and their friends, just like we always have before. And I know that is very, very hard to see. And I guess at this point, what I have to say to that is something kills us all. The last I checked, the mortality rate is still hovering around 100%. All of us are going to die of something. It may be this year, it may be next year. And I hope I don't come across sounding flippant about that, but I met death very closely in a car wreck 3 years ago when I'm the sole survivor. And so as a result of that, I think I probably hold life with an open hand a lot more than I used to. And I understand that, but all of us are going to die. And I think one of the healthy things we can do is we can say, we will, as a society, as a globe, we will get through this. And the people who die, that they will die, and their families will be like other bereaved families, with some unique complications in some, if not many, cases. They will have some different kinds of complications. I'll be honest with you, I am as fearful today for the families whose loved ones are not dying from COVID-19 as I am for the families whose loved ones are dying from COVID-19, because they are swept up in the no funerals, no memorialization, no gathering of people together, and they're innocent victims out there on the edge of all of this. And what I fear may happen if we're not very careful is that we will so enfranchise COVID-19 deaths that we will inadvertently disadvantage or disenfranchise deaths that did not occur. And I saw that after 9/11. We put so much emphasis on those families, that families whose loved ones died in a car crash the very same day felt in many ways disenfranchised, because it was like their death, their loss was not important, and it was forgotten and completely overlooked. And I think it is just as important that we as caregiving professionals pay attention to that reality as well. And thank you so much for letting me do this. And I speak as one man, one person's opinion, and the only difference is that I have the luxury of having a lot of time to think about some of these issues, and I've been thinking about it. Colleagues and I have been writing about it. We've spent a lot of time practicing this for the last however many years we've been in practice, and in many ways the strategies that I've recommended today, many of them are things that I hope I've been practicing all along anyway, and I hope you have as well. So thank you for letting me be part of this educational opportunity.
Absolutely. And thank you again so much for your time and your expertise, Dr. Hoy. And I hope that everyone on here, continues to seek each other out, lean on each other, and we're here for you if you need us. Hope everyone has a great rest of your day. And I will be ending the webinar now. Take care, everyone. Thanks, Dr. Hoy.